You called men's issues as a national health paradox. And you've stated that men have worse health outcomes but fewer dedicated public health resources than women. I want to understand what data points in general on mental health or suicides or homelessness, injuries, joblessness, shelters, or dedicated departments or magazines, for example. You said you collected a lot of information. Can you share some data around this?
Yeah, one of the reasons I wrote that paper, which is now a few years old, is it all it is a big sort of epidemiological review on the status of men's health. So I go through and identify various physical or mental health conditions or other kind of well-being measures where men are doing worse than women are. And the reason I did that is because um, when I was challenging that ACSM position paper, all I wanted to do was include a reference, which was a review paper that described the status of men's health and summarized all these different prevalence rates of all these different things like suicide and homelessness and all the rest. And I couldn't find a good reference. So I actually wrote the paper because I was frustrated that I couldn't myself find that reference. And yeah, so I just go through a list and you named some of the key ones there.